In my experience, when I give a diagnosis of glaucoma, I'm well aware that a patient has many feelings going through their mind. These include fear of the unknown, grief and sadness about why this has happened to them, and also anxiety about how this is going to impact their independence.
What happens when a clinician first meets someone with suspected glaucoma is very different to what is going through the mind of the patient. And often clinicians are thinking of things such as, what's the eye pressure, what's the level of optic nerve damage, what sort of treatment is best, while the patient is thinking, oh my goodness, am I going to go blind? What does this mean to me? And I think the thing to remember is a lot of this anxiety is completely unfounded, particularly if, a lot of people thinking about these things either don't have glaucoma or maybe have a risk factor for glaucoma, like raised eye pressure. And if it gets attended to and well managed, which in 2022 often the case is yes, none of these concerns ever come to fruition. But of course, if it's not discussed, if it's not sort of acknowledged and raised, then it just stays there as a lingering doubt and lingering concern. Glaucoma and mental health are linked predominantly in two domains, depression and anxiety. And there have been a number of studies looking at the link between the two, and they found that people with glaucoma tend to have higher rates of depression and higher rates of anxiety. But we must remember that nothing is in isolation, and people don't have glaucoma in isolation. People might have other health issues, and they might have other, societal and social and economic issues that all interweave in a complex way with their health status. I'm a big believer in knowledge is power, and I'm a big believer in that patients deserve to know everything. We need to provide educational resources to empower individuals to take control of their own health and not be passive users of healthcare facilities. And that's where great organisations like Glaucoma New Zealand and Glaucoma Australia are so important. They offer networks, they offer education. Through them, people don't feel so isolated. They can talk to each other, and of course, those sorts of support networks are so important for mental health issues.
Glaucoma New Zealand can also help provide guidance for patients on what questions to ask their doctors so that they understand their glaucoma a bit more. And I think improving the doctor-patient relationship is a very fundamental core belief of what Glaucoma New Zealand aims to do. I can think of one 47-year-old woman who came to see me for a follow-up visit, and she said she had gone to her GP to start antidepressants. When I spoke to her about why she had started antidepressants, it became clear that glaucoma and the diagnosis of glaucoma had affected her mental wellness and being. The key at this time was for me to discuss more openly about her glaucoma. And when she realized her glaucoma was mild and she was not actually going to go blind, it just transformed her mental well-being and understanding that really this is a chronic disease that was easily manageable for her. So the key was communication. I connected her with Glaucoma New Zealand support groups. And in these support groups, she found other patients who were managing with their glaucoma. And this actually helped her mental well-being, and she felt empowered to continue her journey with glaucoma in a positive way.
I've received a lot of support from Glaucoma New Zealand. Firstly, their website and also their paper resources are excellent. They're written simply and in a way that I can understand, particularly in terms of different treatments that one might be going through, so that you're confident. It's not just having confidence in your surgeon, which I certainly have, but it's actually feeling confident in myself that I'm going to come through this because I understand exactly what's going to be done.
There's so much information on the web and the internet that's not accurate, and this serves as a source of anxiety because you go to some websites and it gives you false information. So please get in touch with Glaucoma New Zealand if you're feeling at all anxious or isolated.